Back from lunch, and I think you have enjoyed yourselves. This training is to help us learn the basic skills in the first aspect of infection prevention. In most settings, this is the initial step where we need to prevent infection and spread to our patients and also to ourselves and to our colleagues. So this is a very big aspect. And the first thing we are going to learn today is a practical aspect of performing correctly hand washing. As I told you before, we are going to have the hand washing demonstration in steps. The first thing is, if you have a watch or rings on your fingers or even bracelets that you have, make sure you remove them before you start doing the hand washing. So I'm going to remove mine, okay? I know some of you may be having those also. So I remove my watch, and if I have a ring, I should remove it to prevent the infection. So first thing is, you remove all those items if you have them. Now, the second thing is that you should do is that you go and make sure that you wet your hands with water, okay? You wet your hands with water up to the level of the wrist. Just allow me to remove this coat, because when you are going to do hand washing for routine, because the indication is that you are going to examine patients. So the ideal is that you are supposed to wash your hand before examining a patient or before you go to examine the next patient. So on subsequent examination, you're supposed to wash your hands. So it is good to make sure that you fold your sleeves if you have a long sleeve for easy, so they don't wet your sleeves. So what we are going to do, I'm folding mine. I've removed my coat because I cannot fold it. And because of routine hand washing, we are going to just expose up to the wrist as far as possible. But when we are going for surgery, we're going to use these scrubs that some of you are wearing. And then we have to make sure we expose up to the elbow for scrubbing, okay? So the first thing is you go and wet your hands under a clean running water. And we are going to use that tap to make sure we do that. And so after wetting your hands up to the wrist, okay? After wetting your hands completely, apply the soap. We have a liquid soap there that we are going to use today. We apply it on our hands up to the wrist, okay? Because there's a difference between hand washing and hand scrubbing. Because for scrubbing, up to the elbow level, because you are preparing for surgery. So in this case, you wet it with water and then you apply the soap. After applying the soap, you go to scrubbing. And these are the steps that you have there in front of you. The step in scrubbing of hands. You start by scrubbing both hands, the palm of the hands. Yes? Start by scrubbing. And this is scrubbing palm to palm. Okay? Then you scrub each fingers, in between the fingers, after scrubbing palm to palm. Now, the best approach that is easy to follow is to count. Make a count of 5. Okay? As you are scrubbing, make a count of 5. 1, 2, 3, 4, 5. And then, as you proceed to each, you also make a count of 5. At each time you are doing the scrubbing. So this time in between the fingers, you count 1, 2, 3, 4, 5. Then the next one, behind your fingers, on each hand. 1, 2, 3, 4, 5. Also the opposite side. 1, 2, 3, 4, 5. Then you go to your thumb. 1, 2, 3, 4, 5. Also the opposite part of the thumb. 1, 2, 3, 4, 5. Now, the next thing is to rub the fingers together. 1, 2, 3, 4, 5. Of course, you will be counting in your minds. You're not going to be counting. Not everyone will be counting while they're doing their hand washing or scrubbing. Okay? You will be counting on your own. You're not going to be telling people 1, 2, 3. You're going to be making a lot of noise. Okay? Then you continue. The tip of your fingers. 1, 2, 3, 4, 5. And the opposite side. 1, 2, 3, 4, 5. For routine hand washing, you stop at the wrist. 1, 2, 3, 4, 5. And the opposite side. 1, 2, 3, 4, 5. Now this is routine hand washing. You can dry it with a clean towel or a paper towel, or you can freely air dry. You understand that? Then your hands is ready to go and examine the patient. Yes? And then after examining the patient, you are going to go again and do hand washing. Now, this routine hand washing should at least take a minute. In other literatures, they can tell you between 30 seconds to 1 minute, but at least the maximum, at least to take 1 minute. Okay? Now, we can also have the same idea when we are doing the hand scrubbing. Okay? The hand scrubbing, normally we do scrubbing because we want to go and perform an operation. And that's the main idea of doing hand scrubbing. With hand scrubbing, you have to expose beyond the level of your elbow. That's why you use a scrub. Okay? So now I'm going to extend this so that I can show you up to the level of your elbow. At all cases, whether you're doing hand washing or hand scrubbing, make sure that you keep your hands above the level of your waist after the hand washing has occurred. Are you getting me? Because you don't want to take it so low that you cannot control you getting your hands again dirty. So I've just followed this so that I can expose the elbow, but you're going to be using the scrub, not like mine here. Okay, so the hand scrubbing, still you do the same thing. You wet your hands, just the same steps as you have done your hand washing. But in this case, you have to wet your hands up to the level of the elbow. Are you understanding? On both sides. Wet your hands up to the level of your elbow and then apply the soap. Make sure the soap goes up to the level of your elbow. Yes? Then after applying the soap, you go to the scrubbing process. The scrubbing process for hand scrubbing and hand washing is similar. The difference is that for scrubbing, you go up to the level of your what? Your elbow. You don't stop at the wrist. You understand? You don't stop at the wrist. So you start the same way, palm to palm. Okay? You do it palm to palm. Then between your fingers. Now I'm not counting 1, 2, 3 up to 5 because I've done that. Okay? But still you'll be counting because for scrubbing at least expected to spend about 5 minutes. Yes? Don't just take only 1 minute and then most likely you have not finished all this. Yes. So you go through between your fingers, then you go to the thumb on both sides. But I believe you have observed when I was performing the hand washing. Same way, you continue. And then behind your hands on both sides. Yes. Then you come to interlocking the fingers. Then you come to the tip of your fingers. Counting 1, 2, 3, up to 5. Like the way we did for hand washing. You understand? But this time you are going to the wrist. The wrist you extend up to the elbow. Are you getting me? Are you seeing I'm moving it? Up to down. It should always go, keep going down as you scrubbing it. Are you getting me? Now, in most cases, you are going to have the scrubbing brush. If you have the scrubbing brush, it wouldn't disturb you because you're not going to be using your bare hands. But in our setting, most time you don't have even the scrubbing brush where everything you use the brush. Okay? Every time, all the steps you use the brush. But in this case, you're going to use most time your hands because we don't have the scrubbing brush. So you have to extend up to your elbow. Now, the moment you're finished with scrubbing, you are going to go and do gowning. Okay? We are going to continue until we finish it.